Hey, I'm Dr. Corey Miller, President and CEO of Ratio Christi Campus Apologetics Alliance. We are on 150 different campuses in the U.S. and around the world. We're doing a podcast series on thoughtful Christianity, which represents our vision statement. Thoughtful Christianity, transforming lives on campus today, changing culture tomorrow. On this episode of Thoughtful Christianity, we are discussing faith, medicine, and Christian response to COVID-19, something that is just rocking the world, literally. My guest with us today is Dr. Ewan Goligher, an MD, PhD. He is an assistant professor of medicine at the University of Toronto. He's an intensive care doctor and research scientist, so he has a paradox, a medical doctor and an academic. His research, including clinical trials in COVID-19, has been published in the New England Journal of Medicine, in JAMA, the Journal of American Medical Association, The Lancet, and several other major medical journals. He's authored over 140 peer-reviewed articles and textbook chapters. He formerly served on the board of the Pregnancy Care Center of Toronto and has written or spoken on a Christian response to physician-assisted death and issues of conscience in healthcare, important issues. He's also on the board of Ratio Christi Canada, where I'm happy to serve with him there. So welcome to the episode, Dr. Goligher. It's great to have you here.
Oh, thank you, Corey. It's a pleasure to be with you.
All right. Well, first of all, this topic of discussion is of interest to both of us for many reasons, as it is for anyone. You can't help but be involved in this issue to some degree, but you in particular, both academically and also as a practitioner of medicine and as a Christian. Tell us why that is so important for you.
Well, so I apart from my research, I practice intensive care medicine, and I work at a major referral center for severe respiratory failure here in Toronto. So since the outbreak of the pandemic globally last spring, I've been on the front lines. People use that term a lot, so I almost hesitate to use this kind of cliche, but yeah, I've actually really been looking after so many severely ill COVID patients.
How many patients have you had?
Well over 100.
Okay.
Myself, and the very sickest patients come to us when when the ventilator is not working anymore and they're potentially needing an intervention called ECMO, or extracorporeal membrane oxygenation. And once they go on ECMO, they have a very high chance of dying. And if they do survive, they're on life support for weeks and months. And there's so much suffering involved for the patients, for their families. I've seen this pandemic has stressed healthcare, in ways that none of us have witnessed in our lifetime. I mean, I've only been practicing for 10, 15 years now, but my senior colleagues have never seen anything like this. So it's been a hugely demanding, exhausting experience. And so I think the development of the vaccine, or multiple vaccines in an incredibly short period of time, was a sort of glimmer of hope in what felt like a very dark tunnel for a very long time.
Yeah, and it's sad that it's been so politicized. I think we'll get to that later in the program here, but it is interesting as a Christian as well. A lot of critics of Christianity think that Christianity is not only false, but now bad, wicked, not useful, but sometimes something on par with evil. Yet on this issue, one wonders if they've ever bothered reflecting even for a moment's notice on the hospital name in which they were born or which they might die in. I mean, you just think about most of the names of hospital take some kind of a religious nomenclature, St. Elizabeth, St. Jude, St. Mark, Good Samaritan, Presbyterian, Methodist Hospital. And we know historically, in the same way that universities were largely spawned from Christianity in medieval Europe and then in America and throughout Southeast Asia. Same thing with hospitals beginning in the 4th century with St. Basil's Hospital in the city of Caesarea. There was a book that I looked at last year, From Monastery to Hospital, Christian Monasticism, I think it's called, and the Transformation of Healthcare in Late Antiquity. And we see that, these things are not accidental to Christianity. They're part of the DNA of the incarnation of Christ, who is the Logos, the logic made flesh, and also the basis for the most robust formulation of the Golden Rule. So I'd love to hear you comment on how you think Christians ought to respond on getting vaccinated in light of the COVID-19 pandemic. And let me just preface it with this. There are a number of people that are going to be hearing this, many of which are going to be Christian, conservative perhaps. They see government overreach. They're skeptical. But this issue has impacted us all. Just this morning, I had to post about a death of one of our chapter directors in the Philippines last night. He had a comorbidity, problems with his body rejecting a liver implant or transplant, but he checked into the hospital a couple nights ago with COVID-19. And so this is a true pandemic. Governments, individuals both handle it differently. And they vie for extremism on security or freedom, and people aren't quite sure what to do. But as a Christian and as a medical doctor and a scholar in the area, what are your thoughts on that? How should Christians respond on getting vaccinated with respect to the pandemic here?
Yeah, so first of all, I want to say I appreciate the interesting historical connections you've drawn. I just finished reading John Dixon's really interesting book, Bullies and Saints, and he drew out some of those same connections between the church fathers and the development of the first hospitals, and it's so interesting to see the way in which our secular culture has been so powerfully influenced by Christian values over the last 2 millennia.
Right.
So that in the pandemics that you read about in the early church, it was the Christians sticking around to care for the sick, and now you see people from very secular backgrounds feeling the same sense of duty and calling to put themselves in harm's way for the good of others, very much reflecting the values that are left over in our post-Christian society. So I think it's really quite remarkable to see the way that the Christian worldview has impacted the culture more broadly, and there's no question that in the context of these remarkable times where we are seeing, intellectual and emotional stresses that we've never encountered before, it makes sense that we're going to struggle to think about how to respond carefully. But I'm particularly concerned to see many people avoiding getting vaccinated, because I really do think that of all the people who should be first in the lineup to get vaccinated, it's Christians. And I think there's several reasons for that. The first thing is that, vaccines are based on science. And if anybody has the basis for being confident about the results of science and their utility in everyday life, again, it's Christians. I would say our culture's, faith in science is, again, another kind of holdover or baggage that we have from the way in which Christianity has influenced social thought over the last several hundred years. And just as an example, when you do a clinical trial of a treatment and you randomize patients and you see a benefit in that trial, and maybe you've done the trial in the United States or United Kingdom or in other places, and then you want to take that treatment and say, now I'm going to give it to people all around the world. The question might be, well, what basis do you have for thinking that the treatment effect will be the same or similar everywhere around the world in the future as to what it was in a small set of cases in the observed past, even if that small set of cases includes thousands of people? We're talking about vaccinating millions and billions of people based on what we observe in thousands. And it's really that for Christians, the confidence we have is that God's upholding the laws of nature by the word of his power. And that kind of constancy in the laws of nature over time, which we repeatedly observe, really it reflects a deep faith in the consistent behavior of nature over time. And that makes sense under a Christian worldview. It's harder to justify that if you deny the existence of God. That's just one way in which Christians really, can find faith and confidence in science, a pretty natural thing. I think the other thing that strikes me is that making a vaccine is a very godlike thing to do. When God created us, he gave us this creation mandate to go out and subdue the earth, exercise dominion and stewardship over the created order. And when we're facing a disease, we're fighting a disease, and we basically take everything that we've learned about the way the immune system's designed, thinking God's thoughts after him, and say, hey, we're going to prime the immune system ourselves so that we're prepared to fight this thing when we get it. We're doing exactly what God created us to do. We're operating in his image. And to me, it's a very powerful reflection of the way in which humans fulfill the creation mandate, whether we realize it or not, when we're going out and designing a vaccine and using it. I think there's been a lot of talk I've heard about, the kind of inconsistency we see in others who ordinarily are advocating a my body, my choice attitude with respect to, controversial ethical issues like abortion and so on. But then it seems like they adopt a very different approach in expecting others to offer up their body to be vaccinated in order to advance the common good. And I think if anyone should be prepared to offer up their body as a means of advancing the common good, that's kind of an extreme way of putting it. I think it ought to be Christians. After we'll follow a man who offered up his body to do us the ultimate good for us. And, there's specific instructions in Scripture, for example, in Romans, where we're instructed to offer our members as instruments of righteousness. We're called to be those who do good works in the world and bring, God's blessing and advance human flourishing. And insofar as we can benefit not only ourselves but others by getting vaccinated, well, then I think it seems to me like we should be the first people in line to do so, even if that means that we're going to use our body to that end. And then I really think we're both very concerned about apologetics, about Christian witness, about the way in which we want people to see that Christianity is reasonable and that it's good, that it advances human flourishing rather than detracts from it, despite the perceptions to the contrary that you were citing at the beginning of our conversation. And I think if the world saw Christians en masse lining up to get vaccinated, saying, look, I'm not working in healthcare, I can't look after the sick, but I can do my part to prevent the spread of this devastating illness and to prevent the development of new variants through the spread of infection. Well, by being motivated to do so, by that being characteristic of a Christian, that's a very powerful witness. And I think of the words of 1 Peter, where we were instructed to keep our conduct among the Gentiles honorable, so then when they speak against you as evildoers, they may see your good deeds and glorify God in the day of visitation. This is just one example of a good deed, in my opinion, that would allow us to glorify God on the day of visitation. And I'm saddened by the fact that, if anything, I think Christians may be known for their resistance to vaccination at this time, and I would love to see that change.
Yeah, and I want to take a minute near the end to discuss, why we think the conservative Christian community in particular might register some skepticism on this. I'm sure a lot of people listening to this right now are among them, and validate what their concerns are, and maybe talk about a way forward as a culture, as a civilization, because we're all facing some other issues going on right now too. But it does resonate from a Christian perspective that we follow Jesus, and Jesus was self-sacrificial for the good of the others, and that's what love means in Christian viewpoint, is willing the good of the other. And so, it's a question about love, of whether or not we get vaccinated, a question about rationality as well. We've had conversations in the past about this. If something is irrational, it may not be a loving thing to do. If it's rational, it may well be a loving thing to do. And I think that's a question that people might register in terms of skeptical aspects on the rationality. But I'd like to talk about that. But some people might bring up objections or concerns. What about these vaccines? I don't want to just inject anything into my body. I mean, Jesus wants us to be good, not dumb. He wants us to exert a ventured trust, a reasonable faith. How do we know that these COVID vaccines work, and how well do they work?
So, the first thing I would point out is that there's a long tradition of Christians using something like vaccination in order to prevent the spread of disease. And I think of Jonathan Edwards, for example, quite famous
American theologian,
Christian leader from the 18th century, mm-hmm. who actually died as a consequence of smallpox vaccination.
Mm.
Perhaps not the poster child for the safety of vaccination, but getting vaccinated for smallpox in the 1700s is very different than getting vaccinated for COVID-19 in the 21st century. The point I'm trying to make simply is that this is entirely consistent with the way that Christians have tried to fight the spread of disease in the past, in mm-hmm. principle. And certainly since the advent of the polio vaccine in the mid-20th century, and the development of other vaccines, a much more effective smallpox vaccine. In fact, smallpox has essentially been eradicated from the planet through vaccination. So in principle, you can do immense good. Now I understand that people have questions about a new vaccine, one that's developed at quote unquote warp speed, and maybe doesn't have years and years of follow up the way that some other vaccines have. But I think there's several reasons to reassure ourselves. First of all, I want to say that I was vaccinated within a month of these vaccines becoming available last year.
Important to know.
I was seeing these patients. All the time, so I was, at some risk of getting infected myself, bringing it home to my family, and so I was an early adopter. So I tried to practice what I'm preaching here. The clinical trials where the vaccines were evaluated in randomized clinical trials, really the gold standard for assessing treatment efficacy and safety, because it allows you to directly decide what the causal effect of the drug is. They were conducted in a very rigorous manner in thousands and thousands of patients, and the signal for preventing the development of infection, and more importantly for development of severe illness, was very, very strong. I mean, so the Pfizer vaccine, which is probably, and Moderna, probably the two most widely available vaccines in the United States, are, both in the order of 80% effective in preventing infection. That's largely held up with some of the new, more contagious variants, although their ability to prevent infection, just sheer symptomatic or asymptomatic infection, is somewhat lower with the more contagious recent variants. But what's really impressive is their ability to prevent the development of severe illness and hospitalization. So that's really been a game changer on the order of 90 to 95%, which means that only 5%, if you have 100 people who would have been severely ill before, 95% of them would not need to be admitted to hospital if they were vaccinated. So that just dramatically changes the course of the illness for those who do get infected.
And so the vaccinated can still get infected, and they are. We're seeing, like in Israel, for example, the most vaccinated country maybe in the world percentage-wise, yet they're getting knocked over the head with this new variant. And I guess we've learned some things about that too, right? But at the same time, you're saying that even though the vaccinated can still get admitted to hospitals, they can still catch COVID. You're saying it's not as much, and the hospitalization issues are different as well?
Well, it's a dramatic difference. I mean, you you can think of it really what you're doing when you're vaccinating someone is you are priming their immune system to fight off the infection. So it's no surprise that if you come into contact with COVID and you're vaccinated, that you can still contract the infection. Your immune system might, prevent it from taking hold at all, but there is still a meaningful chance that you will contract infection, which simply means that you've got virus replicating at the back of your nose, and that's how you detect it. And you might feel somewhat unwell. You might have a head cold. You might have some fever, etc. But what's really important is that you prevent the virus from disseminating throughout the body, that you prevent it from taking hold in the lung where it causes a severe pneumonia. And that would entail hospital admission and potentially even ICU admission. That's what really puts you at risk of death. And so by priming the immune system, it basically prevents the virus from being able to replicate and disseminate. And so that's where you'd really expect to see the effect. Now, it's not perfect. It's 95%. And so that means when you've got hundreds and thousands and millions of people getting infected, even those who are vaccinated, you're going to see some people getting admitted to hospital. But the numbers that we've seen are exactly what you'd predict in a manner consistent with a 90 to 95% efficacy rate. And so it's really dramatically changed and reduced the number of people who would otherwise have been admitted to hospital. Well, I think that's the main thing.
I mean, what about natural immunity then versus vaccinated artificial immunity? Didn't God create our bodies to be able to fight off these diseases? And if we've had COVID already and we have antibodies, is this going to do anything? Why should we get vaccinated even if we've had COVID?
Right. No, those are great questions. So there's no question that natural immunity is a great thing. And if you've been infected with COVID and you've developed an immune response against it, then that's great news, and and your body's doing exactly what it was designed to do. There are two issues to consider. First of all, as far as we can tell, natural immunity is somewhat weaker than vaccinated immunity in the sense that it's slightly less effective at generating an antibody response. Natural immunity, on the other hand, seems to be more durable than vaccinated immunity. So if you have natural immunity, it seems that 6 months out or a year later, you mount a stronger immune response than you would if you'd merely been vaccinated 6 months or a year. So there's no question that natural immunity is good and effective, and but because of the lower antibody response, there's a recommendation to get usually a single dose vaccination after infection. The issue is that natural immunity comes at a huge cost. Really this COVID's never going away. It's probably going to be.
People don't want to hear you say that.
No, I know. I'm sorry. But it's probably going to become like seasonal influenza, where it circulates. So a few people get very sick from it. Most people don't, and that's probably what's in the future for us. But until we get to the level where we have widespread population immunity to the virus, we're going to see these kind of waves of hospitalization and more serious illness. And we're going to see the development of more contagious variants, because as the virus is circulating widely, it has the opportunity to mutate, and the more contagious variants that develop naturally will take hold in a population. So until there's widespread herd or population immunity, this is what we're going to keep seeing happening. And the more contagious a variant is, the higher the level of population immunity that you need to shut it down. But those waves come at an immense cost, which I think we've all seen the last year. You've got millions of people around the world who died of COVID or died of complications of COVID. You've got, beyond that, millions of people who've been severely ill from COVID and are still reaping the kind of long-term disability that we see after severe critical illness. That's something that people aren't talking about so much. That we know is that if you end up in my ICU, that's a life-changing event. You're never going to be the same again, physically, functionally, even if you're young. So there are huge consequences even for survivors of severe COVID, and and there's a really interesting paper just published in the New England Journal, I think 2 weeks ago now, that compared the event rates of some of the kinds of illnesses that people are concerned about from vaccination. A big one being myocarditis or inflammation of the heart.
Yeah.
And you can see that actually, if you contract COVID, you're much more likely to get myocarditis than you would be if you were to get vaccinated. There's a population level data coming out of Israel. So even the things that we worry about from vaccination, probably getting infected is worse.
So you can get from getting vaccination, you can get the myocarditis, but you're saying that you get a better chance of getting it if you've had COVID.
Yes, you're much more likely to have it if you get COVID. So in so many fronts, so natural immunity is great. If it came at no cost, then there'd be no issue. But it comes at a huge cost to a population, and I think probably the main reason why we're not so worried about the cost of natural immunity is because we live in very privileged societies with access to nearly infinite healthcare resources. And if you live in a society in a developing or lower middle income country where you can't rely on healthcare to be there for you, then that cost is immense. And I think we need to bear that in mind. There's a sense in which a lot of the resources we're consuming to look after people when they get sick could be dedicated to meeting needs elsewhere. And
interesting
and I think
point.
That's just one more reason why we should be concerned to get vaccinated.
Yeah, I've heard some people suggest, even some people with medical backgrounds, that they have concerns over the mRNA vaccine technology and the spike proteins, and isn't it going to do something down the road and the whole human race self-destructs? Not in that exaggerated way, but we're not talking about World War Z here and Brad Pitt and Hollywood, but it's experimental. And given that this is so now, isn't it safer just to hold off? Again, it's a reason and a loving issue here.
Right. No, I think that's totally a fair concern. It's anytime you're talking about a new kind of therapy or intervention, and certainly one that sounds unfamiliar and exotic like mRNA, then I can understand why people have questions and reservations. So when people ask me about mRNA vaccine, I like to tell them that they maybe haven't learned much about mRNA, but mRNA is sort of how your body figures, or what your body uses to communicate between DNA and proteins. So I liken it like, let's say I'm doing a building project and I want to tell the contractor exactly what I want done on a certain part of the project. Well, I'm going to send him an email describing what I want done, and the mRNA is like the email. Your DNA is sort of like the plans that you have, but the mRNA is the conduit for communicating the plans to the builder. And it's really a one-way kind of street. It's used in cells basically as the information that's used to build a protein. And you're making tons of mRNA constantly in every cell in your body. So that if you were looking for a natural product or substance, this would be it. Now, what's really exciting about the mRNA technology is that because it's easy for us to write an email compared to actually building the house, we can write the mRNA sequence that tells the body exactly what it needs to build in order to develop immunity against the virus. And in this case, we give it a sequence that teaches the body to build a structure analogous to the spike proteins, that you develop immunity against the spike protein, because that's really what's unique to the virus. You obviously don't want to give it a sequence that teaches the body to attack itself.
Yeah, that'd be bad.
But this was always the risk with vaccines, or the theoretical risk. Vaccines are very safe, don't get me wrong, but traditionally the way that you would vaccinate someone is you would infect people with a virus itself, and it would be an attenuated or inactivated virus that the body would target for immunity. But But in theory, there's a lot of different targets that you're giving the body there. Whereas with the mRNA vaccine, you have much more control over what the body's targeting. So actually, the first trials of an mRNA vaccine started out in the early 2010s. I think 2012 is the earliest one I saw, of actually where they're using this to help the body develop immunity against a cancer. So if you get cancer, then you can build an mRNA sequence that would teach the body to target specific features of that cancer cell type that would allow the body to target and self-destruct. So that's really the original development and direction for this technology. And the COVID pandemic became an occasion where they need to say, we need a vaccine tomorrow, because, thousands and hundreds of thousands of people are dying. Well, what's the fastest way to do that? Well, with an mRNA vaccine. And of course, there was technological developments in terms of being able to deliver mRNA into the body without it just falling apart and so on. So it was exciting opportunity. But I would say if there's any kind of vaccine that you would expect to be maximally safe, it's actually going to be mRNA because it's so targeted for this.
It's like a precision guided missile rather than a buster bomb.
Exactly.
All right.
Yeah.
Well,
I think one other thing I would just want to say from a safety standpoint, people that should understand is, these if you call them drugs, remain in the body for only a very short period of time, 2 to 3 weeks after vaccination. The vaccine itself is completely clear. The mRNA is broken down. The delivery vehicle is completely broken down. And this is why, in general, with vaccines, you see that if you are going to develop a side effect, it's going to be in a very short period after vaccination. That's true of many different vaccines, not only just COVID vaccines. And so this is why the concerns about long-term follow-up are we can reassure ourselves that actually if we are going to see problems, we're going to see them relatively quickly.
Yeah, and so I guess that helps to answer that question about, the byproducts, because we haven't been at this for very long, but I guess we've got a ton of studies on it, even though it hasn't been very long, studies cross-country and in a country. What about, and I guess, most recently in America, it's gotten FDA approval. Some might say, yeah, that's because they were, trying to get everyone vaxxed up quick enough. Again, that's one of the skeptical questions again. But it does have FDA approval now, and it did go through the ordinary processes for security on that?
Yeah, I mean, I'm not an insider on regulatory processes, but in my experience, having been involved in some regulatory trials, is that the bureaucracy is extraordinary. It didn't surprise me at all that it took a long time to get regulatory approval.
Okay.
And normally, everything's been moving as fast as it possibly could on COVID time, as we call it. Things are starting to slow down again, but I wasn't at all surprised that it took as long as it did to get regulatory approval. And it's one of those things, of course, where you feel skeptical beforehand because it's not approved, and then you feel skeptical afterwards because they approved it so quickly. So you can't satisfy that particular concern apart from all the other reasons to be reassured.
Yeah. Well, I'm going on almost 50, and so 50 is the new 30. So myself, my family, we're pretty young and healthy. We're at low risk comparatively for severe illness. Why should we be vaccinated?
Yeah, that's a fair question. I think there are two reasons. First of all, the truth is that you might feel comparatively low risk, but there are lots of people in your situation who have gotten sick. I've looked after them myself, people in their 20s, 30s, and 40s without comorbidity. And certainly, of course, having comorbidity or being older increases your risk, but it's not zero. And it's the nature of an infectious pathogen like this that everyone's going to get infected at some point. It's really a matter of time. You might not get infected this year or next year, but you're going to get infected at some point. And, in more likely than not, you'll have a comparatively mild illness, but there's a real risk that you could get very sick. It's not zero. And if there's a way of preventing that from happening, that's cheap and
Mm-hmm.
immediately available to protect you and your family, well, I don't understand why we wouldn't go for it. I think there's also a common good element to this, because
Mm-hmm.
if the virus is circulating widely, even those who only develop mild or even asymptomatic infections still serve as a host
Mm.
to spread it to others. And so the best way for us to shut this thing down, and to protect those who are more vulnerable, those with compromised immune systems, people with cancer getting chemotherapy or getting transplants, etc., for whom vaccination helps a little bit, but it's not nearly as good as it is for you and me. We can do them good by ensuring that we reduce our own risk of spreading it to others through vaccination.
Okay.
So there's certainly an element of self-interest, but I think there's also an important element of participating in the common good.
So this brings up, I think, what is some final thinking for our purposes here on this. And when you talk about shutdown, we heard it was about 2 weeks to curb the issues so that the hospitals didn't get overrun. And now it's going on, 2 years. You're saying it's going to be with us a whole lot longer. And we've seen countries act quite differently. Western countries like Australia, amazingly seeming to curtail freedoms for security. And this is that age-old, spectrum question. Do I want more security or more freedom? Well, if I want to be alive, I want security so that I can be alive to be free. Give me liberty or give me death, as it were. So, we have this new thing that has created havoc. We've learned a lot since that first 2 weeks, and there's been a lot of shutdown. There's been lockdown. There has been put down over people who, let's say, didn't get the vaccination, maybe because they're concerned about what we're seeing in our country in the U.S., where you're at in Canada, across the world now, about the politicization of medicine. I think most people will probably see that, say, Dr. Fauci, for example, said some things early on and then later justified it in good utilitarian ethicist fashion, that the end justifies the means, and justified telling a white lie for the greater good. And people now are saying, okay, what could he be lying? What could they be lying about now? And further, when doctors come out as area experts, because most of us aren't doctors, even those of us who have doctorates still really don't know, where to turn on all of this, because politicization has happened on this and every topic right now, where big tech, social media, and media, it's called cancel culture in the West. Unless it's the political truth, it's more political science than science sometimes. People just aren't so sure what to do. They don't want to sacrifice their families. That's not loving if they can't trust the information coming down the pike. And so this question over security and freedom, they want the freedom to be secure. They want to give this more time, perhaps. They, as Christians, want to do the right thing. They want to help people out. And if that means being vaccinated, great. But what are we supposed to believe? How do we overcome this bit of not unreasonable skepticism now?
Yeah. Well, yeah, I think you're raising the profound problems of political philosophy of our age. And, I don't pretend to be an authority on those matters. I think I would take a step back on this, actually, and put these large issues of how we respond to disagreement in the broader context of the ways in which views on conscience and freedom of conscience have evolved more generally in our generation, and with the secularization of society. I think that one of the gifts of Christianity to society was a very high view of individual conscience. The notion that each of us, as a creature made in the image of God, is endowed with moral reason and moral judgment, and that there's a very much a sense in which no one can sit in moral authority over you to tell you that you're necessarily wrong or right, but that each of us, as creatures made in God's image, equally have access to moral right and wrong. I mean, you're a philosopher, so you might have a lot of interesting things to say about this. But it seems to me that one of the things that's changed, and I saw this change happening before COVID came along, particularly with respect to, say, freedom of conscience in healthcare in Canada, was an evolving sense that sort of that we can overrule the moral knowledge and authority of others, that we can expect them to conform to our own particular moral ways of thinking, and that we're going to, and where people disagree, because of the difficulty of establishing moral right and wrong that we've inherited potentially from postmodernity, the only option is to coerce, because there's no real basis for persuasion. And I've seen that. So, this is a big problem in Canada right now with respect to freedom of conscience for physicians around issues like physician-assisted death and abortion and so on. And I think it's that loss of confidence in the ability to do the work of moral persuasion, together with a diminished view of what a human is, a kind of dehumanization that's occurring, and a loss of sense of what meaningful human flourishing really looks like. All of those things combined together have created this kind of technopoly where, everything's about preventing the spread of infection at all costs, and we have no coherent way of balancing the risks and benefits. I confess I myself have really struggled to balance the risks and benefits. I think, for example, the evidence is now pretty clear that the benefit of masking is probably very small, but it's certainly not zero. So do we make millions of people masks to save hundreds of lives? I don't know how to balance that exactly. I personally feel a bit uncertain. I've been an advocate of masking throughout the pandemic based on the data that we have and the reasonable presumption that it's appropriate. But I think these things force us to think very carefully about how we weigh these different factors. And I think the truth is, this is why we need thoughtful Christianity, people equipped to engage the life of the Christian mind and bring to bear the deep traditions we've inherited from Christianity over the last millennia, to say, how we prioritize human life, what does human flourishing look like, what are the costs and benefits of keeping ourselves apart, and for how long do we continue to do this? At what point do we start to accept different costs? And Christians might answer that a bit differently than others. We're just not afraid of dying.
That's
as
true.
faithful believers,
Right?
And I think that's a big part of this, to be honest, is that we're just not afraid of dying. So we don't feel the urgency of getting vaccinated in that sense, the way that others might. But I think all these different factors. But I think what's going on is, I'm talking a lot, but I think what's going on is very deep. It's not. These are not surface issues. These are deep issues about shifting understanding of what it means to be human.
Right.
And that's the challenge that we're facing.
Yeah, and part of that governs how we understand political philosophy, right? We are in a cultural revolution in the West. There's no doubt about that. Our organization, Ratio Christi, primarily deals with universities, but the university from Harvard on down was about veritas, about the pursuit of truth, and that includes Harvard Divinity School and Harvard Medical School as well. If people want other people to, say, get vaccinated, they ought to do it the way you're talking about, and that is persuasion, not coercion. You don't call people racist if they fail to wear masks. You don't try to destroy people or take away their livelihoods if they're wanting to get genuine answers and they want to see debate. Debate is not hate, and the university system really needs to open itself up and be about the pursuit of truth once again, because it's curtailed that. And in the same way, I wish we could speak here. I wish Zuckerberg and all the big tech elites might listen, because we would love to see more debate on hot topics and be able to pursue and debate what issues are true. I think we would get a lot more compliance than defiance on important issues. This is not helping us, this cancel culture, and it's one of the tragedies of our times if we allow medicine to continue to be politicized. So thank you so much for taking time. Thank you for your work in the research lab and also at patient care at the bedside and with Ratio Christi, so that we can continue to push people to be about thoughtful Christianity, transforming lives on campus today, changing culture tomorrow.